Thought I would talk about a recent study that came out in the MMWR journal that looked at vaccine effectiveness and performance with 2 and 3 doses, particularly against Omicron, and what that potentially predicts for summer and beyond. So this is a study, if folks saw it, came out just recently. It was pre-published a week ago, I think it was last Friday, in MMWR, and it looked at the effectiveness of vaccine with 2 or 3 doses over essentially a 5-month period, and was able to differentiate performance or vaccine effectiveness against Delta and Omicron, as during that period of time was obviously the switch over between Delta and Omicron dominance in the US. You can see the Vision Network, which I think we've looked at some studies out of this network before, is health systems in a number of states, as you can see there. And it covers a pretty wide sampling of the country, from East Coast in New York to West Coast in California, and then places like Texas, Indiana, Utah, Colorado in between. So a pretty good geographic coverage of the country, and a relatively diverse set of health systems. Most of them are urban, so that is a bit different, although there are some of these health systems that cover rural areas in various states. And what this study did is looked at 240,000 emergency department and urgent care encounters and 93,000 hospitalizations. It used the test negative case control design, which we've talked about before. There are some inherent biases there, and so you need to take that into account. But in general, looking at folks who come into the hospital or emergency department and whether they test positive or negative for COVID. Now, these were people who had a COVID-like illness, and so relatively similar in that respect. And then you can see they used location-specific dates to tell when the switch over from Delta predominance to Omicron predominance occurred. And this network has done studies like this before, and they do age match. And so there is some controlling for the biases that occur in there. So here's just, again, an overview of the data they looked at. Again, over 240,000 visits to the emergency department, and you can see about 62,000 of those tested positive for SARS-CoV-2. And you can see that there were more cases of Delta during this period of time, but again, a longer period of time to accumulate Delta cases than there were Omicron, but a pretty good sampling of Omicron. You can see there that over 24,000 cases of Omicron and over 55,000 people who were analyzed during that period of time. And then if you look at the timing from or doses in terms of time from last dose, you can see that for 2 doses, they had a pretty broad representation of folks even out greater than 5 months from their second dose. That's above that red arrow. And obviously, most people who had their second dose had it earlier in the year and had a longer time to have that stretch between second dose and when they were analyzed. You can see for third dose, it really started to whittle down numbers pretty quickly once you got past 3 months or so. And for the group that they analyzed, looking at greater than or equal to 5 months after their third dose, it was very small. You can see only 29 patients. And that makes sense, right? Not a lot of people got boosted before August. And during that period of time, August to December, mostly it was people who were older with higher comorbidities, and so a smaller group to begin with, and then less time to accumulate. So you have to kind of take that into account when you're looking at some of the third dose data, particularly past 3 or 4 months. But what you see is for Delta, which is that first circle there. Well, up at the top left, this just shows you that this is analyzing vaccine effectiveness against emergency department or urgent care visits. So how much less likely are you to be COVID positive if you're vaccinated in those who went to the emergency department or urgent care, right? So that's how this vaccine effectiveness measurement works. And you can see for Delta variant, during the Delta variant predominant period of time, both folks with 2-dose series and 3-dose series had pretty good protection against COVID. So the vaccine effectiveness rating for these folks was even at worst 77% for 2 doses after 5 months. That's still pretty good protection for Delta. But what you can see down below is during the Omicron predominant period, those last 2 circles, that vaccine effectiveness had dropped considerably. And you can see that that arrow there points to people who'd had a second dose 5 months or greater or longer than when they went to the emergency department or urgent care. So if it had been 5 months or more since your second dose, you had a pretty low vaccine effectiveness rate at that point. It's 37%. You can see that your vaccine effectiveness from a third dose jumped up considerably, and that at 4 months, you still had relatively good protection if you'd had a third dose, 66%. You can see that 5 months or greater, that dropped down considerably, but you have to take into account that's a very small number of 29. Most of those are high risk and elderly, so it's hard to know. It's hard to put a lot of certainty around that. There's a large error bar around there, as you can see. But certainly what we can see is that the third dose gives you a much higher rating of protection. So vaccine effectiveness of 66% at 4 months compared to 48%. So really a 20% jump compared to 2 doses with Omicron. And the difference between Omicron and Delta is huge, but there is a significant waning over time, which is the other thing that is important to keep in mind. And that degradation of protection against Omicron is much more pronounced than it was for Delta. And if you look at hospitalization, which was the other thing they analyzed, you see a similar trend. So this is, again, the Omicron predominant period, showing that you still get pretty good protection with 2 doses, but it wanes significantly over time. And 5 months or more after your second dose, you're down around the 50% range of vaccine effectiveness. If you look at people with 3 doses, you can see that vaccine effectiveness against hospitalization goes way up. And so now you're talking 91% for people who are very close to their third dose. And even 4 months or greater, you're still at 78%, which is pretty good, right? Higher than even your 2-month protection after 2 doses, which is that comparison of arrows right there. However, you're still seeing a decline, which is concerning. And if you start to map this out over time, it reveals, I think, a pretty alarming reality, which is this is for emergency room and urgent care visits. So looking at that vaccine effectiveness, if we were to do a kind of a theoretical exercise and assume that everybody got their second dose on January 1st of 2022, and so this is what the degradation would look like over time from the data from this study, you can see that by the 1st of May, if you'd only had your second dose on January 1st, you're already below 50% vaccine effectiveness in protection against emergency room or urgent care visits. So that's, essentially people who are sick enough to require a visit to urgent care or emergency room. And you can see that even for people who've had a third dose by the summer of 2022, if the trend continues at the slope that the data indicate, those folks will be below a vaccine effectiveness rate of 50% by the middle of summer 2022. And so what this indicates is if these data are an accurate representation of the degradation of vaccine effectiveness, we are going to require boosting probably every 6 to 12 months for folks who have no risk factors, right? And you can see that there's probably going to be a difference between how rapidly this immunity wanes for people who are over the age of 65 or have other high risk factors, which it's going to be faster, versus people who are in their 30s and 40s, where it's going to be a slower decay. But for people who are high risk, certainly it looks as if effectiveness and immunity from a third dose is going to wane significantly by, these data indicate, 5 months or so. And so by 6 months, those people are definitely going to need a booster. And if they're not boosted, and if folks who've only had 2 vaccine doses don't get an additional dose, we're going to have very low vaccine effectiveness against symptomatic disease severe enough to require or at least a visit to the hospital and hospitalization from those other data. And as we've seen from some of these studies, the protection or immunity against actual infection and ability to spread is even lower. And so we're going to have very limited immunity as a population against infection, against the ability to spread, and even against significant clinical disease that will require emergency department and urgent care visits and hospitalization by summer of 2022, unless we do something dramatically different to increase our rate of people who've gotten a third dose or have gotten a dose of vaccine recently. And for many people, that's going to require a 4th dose by the summer. And to be honest, the way things have gone over the last 6 months, I think it's very unlikely that we're going to be able to convince a significant proportion of the population to get another dose of vaccine between now and summer. And if we don't, we're going to be in exactly the same situation where we were this past summer when the Delta wave hit lots of southern states and then came into the rest of the country in the fall. And potentially even in a worse scenario, because I think our protection, our effectiveness of protection by mid to late summer 2022 is going to be even lower because people will be so far out from their last dose of vaccine. This is also assuming that what we're going to see is a resurgence of Omicron in the summer, which these data, really are related to. If there's a new variant that arises between now and then, which is certainly a distinct possibility, then we're looking at potentially even lower amounts of immune protection because of the amount of immune escape that's likely to occur from a new variant. And so what this means is we're probably going to have a very bad summer and fall again, unless we do something differently to increase the rate of people who've received a 3rd and 4th dose of vaccine. That's all.